Assalamu alaikum, Mu'mineen. Assalamu alaikum, brothers and sisters. Bismillah ar-Rahman ar-Rahim. I'd like to first thank Momin for giving me this opportunity to be with you and to discuss how to reduce the risk of COVID-19 infection and its complications. To have the correct perspective, I thought I should start with an ayat from Quran. The ayat goes like this, Bismillah ar-Rahman ar-Rahim. وَمَا أَصَابَ مِن مُصِيبَةٍ إِلَّا بِإِذْنِ اللَّهِ وَمَن يُؤْمِن بِاللَّهِ يَهْدِ قَلْبَهُ وَاللَّهُ بِكُلِّ شَيْءٍ قَدِيرٌ بِكُلِّ شَيْءٍ عَلِيمٌ. No disaster or affliction comes about but by Allah's permission. And whoever believes in Allah, He guides his heart, his qalb, and Allah is aware of all things. We as individuals and as families, as communities, have not faced times like these. The fear of death and disease is palpable. Amidst the news of sorrow and separation, suffering and grief, we hear about stories of courage and sacrifice and compassion and healing, and that are so uplifting. Through all of this, Allah is watching each and every one of us to see how we will conduct ourselves. What's important to note is that Allah is not a silent spectator, but eager to guide and help us whenever we call Him. So our approach to COVID-19 epidemic or pandemic, as a moment, in my humble opinion, should be based on dua and actions or amal based on scientific knowledge. What I would like to caution our fellow Mu'mineen is not to base our information on myths or rumors and then to spread this through social media, because that could be harmful. So in the beginning, what I would like to do is to summarize some facts about the coronavirus. Many of you already know, but I'll go through it quickly so that we get some scientific data-based facts. Coronavirus is well known as an RNA virus. There was an epidemic from SARS virus, which was several years ago, and MERS virus from the Middle East. It is a type of a virus that originated from bats. The RNA composition is very close to a bat origin. But now it is being transmitted from human to human. If all human activity were to stop for 2 weeks, this virus will perish and will go away. But because of human interactions and contacts, the virus continues to spread from one host to another host. That's how it goes. The most likely mode of transmission is droplet. So as a person coughs or sneezes or blows their nose, the droplets that come out in the atmosphere are then either inhaled by another person or they make contact with their skin, such as their hands. And then it cannot penetrate through the skin. It has to go through mucosal membranes. And those membranes are exposed to the outside world, are the eyes, the nostrils, and our mouth. So when we take our hands or fingers and touch these parts, then it gets access to another host. What is concerning is that there is also a component of airborne transmission. So just by mere breathing in and out. So a person may not be coughing or sneezing, but just by mere breathing and talking, there's enough aerosolized particles that are suspended in the air in close proximity, and another person inadvertently can inhale them, or they can get on their surfaces and they can come in contact with them. There was a study recently reported by MIT scientists in which they did an experiment. When they made a person cough, the cough particles were seen down 18 feet. And then when a person sneezed, the particles were down 24 feet, up to 24 feet. Of course, the highest cluster is in the nearby, within 4 to 6 feet, but it can spread as down as 24 feet. Then they checked in the hospitals from South Korea and Singapore, they check the vents up in the air of the in the rooms and the hallways of the hospitals, and they found air particles that had virus in them. Hence the recommendation to start wearing masks when you go out in public places where you suspect there will be other people. If you're just going out in your backyard or going for a walk and you don't expect other people, then the chance of acquiring a virus infection is extremely low, but the risk goes up when you're going grocery shopping or to a post office or to your workplace, even if you're a non-healthcare professional. The good news is that a simple household bleach kills the virus within a minute. The incubation period, which is called the time from the exposure to the onset of symptoms, is between 4 to 5 days. And that is the time where a person can keep shedding the virus, transmitting it to others, not knowing it's a complete innocent transmission because the person is not sick and they may just be interacting with family members and friends and transmitting the virus. Now let's move on to what if a person catches the virus? What is the likelihood that they're going to fall ill? And how bad will that be? In 81% of patients, it will be a mild illness. It will be illness that they may have fever, they may have cough, they may have body aches, they may lose the sense of smell, their taste may be altered, kind of flu-like symptoms. And amongst those 81%, 17% will have no symptoms, but they would have the virus. This was based on the data coming from people who are on cruise ships. And when there was a spread of virus in the cruise ships, they identified these people and identified that 17% of patients had no symptoms whatsoever. So again, 81% would have mild disease, will recover completely by themselves. 14% will have severe and 5% will have critical. So roughly a group of 20% will be severe or critically sick from this disease. The mortality or the risk of dying from it ranges from 1 to 10%, and on average about 2 to 3%. Who is more at risk of dying? 70% of people who died were men, 30% women. People above 18 years of age are vulnerable. Now, the older the person, the greater the likelihood. But just today, I heard of a 33-year-old physician who died in Michigan. And so there are these reports that keep coming. And many of those will not have pre-existing conditions. But again, vast majority of people who will get severely ill or end up dying from the disease would be older, greater than 65. 65 is higher risk, greater than 55, you start getting quite vulnerable. The other major risk factor is comorbid conditions, meaning other illnesses such as heart disease, high blood pressure, lung disease, cancer, kidney disease, other conditions such as rheumatoid arthritis, where people have to take drugs to suppress their immunity. And those who are morbidly obese, which is their BMI of greater than 40, are at a high risk of death from this viral infection. So once a person catches a virus, there are two courses of action. The one course of action would be about 80% likelihood that you will recover completely, you will fall ill, but it would take about 3 to 5 days, maybe up to a week, and you'll recover. And there's another group that it may progress fast. Within a few days, they will have high fevers, followed by shortness of breath. There's one thing that you've got to remember. If a person develops shortness of breath, that is a sign of trouble and they need to go to the ER. Let's now discuss at-home care. Let's say if a person falls ill, how do we take care of them at home? And this is a large group of people, the 80%, they're still shedding the virus to other people. So the best thing to do is to isolate them, to put them in a room where they are by themselves. They should sleep in that room, they should eat in that room, and ideally, if there's a room that has an attached bathroom, it would be ideal to use that bathroom that nobody else is using. But if If the home situation is such that it cannot be done in that manner, then the best possible way to isolate and dedicate the bathroom to that person, it would be really nice for that person who is sick to wear a mask when anyone else enters the room. So that's the best way they can limit the spread um, of the virus when they cough in the presence of somebody else. They should use the household, this is just common sense stuff, use disposable plates, spoons, and glasses that you don't have to then put it in a dishwasher or have to wash them. There should be a plastic trash bag in the room, and that trash goes straight from that room to outside for disposal. They should have separate towels, just most common sense stuff. Ideally, the surfaces should be decontaminated on a daily basis. Um, it would be good to take, if somebody is taking care of them, that is a young person, and the person who is otherwise healthy, then their risk of catching the disease and getting sick from it would be very low. Um, and again, I'm accessible. There's so many excellent physicians in our community and your own primary care doctors. They can reach out and they would be more than willing to help you, to guide you what to do in case somebody does get ill. Now the question comes up, when to stop the isolation? When can the person come out? CDC recommendations say that ideally they should have a coronavirus test when they're completely recovered, they have no fever, no symptoms from the nasal pharynx, 2 tests 24 hours apart. And if those both are negative, they can come out. Well, that's not practical. People who are sick are not getting tested. So what is the other way? The other way is when your symptoms completely subside, ideally wait between 3 to 7 days. Although there is, CDC site says 7 days from the onset of symptoms, but I think a good rule of thumb would be total of 14 days. And that's the time that people have been putting themselves in quarantine when they have come from a travel from a highly endemic area. The virus shedding continues up to 10 days from the onset of disease in people who only have mild disease. For those who have severe disease, we'll talk about them separately. They can shed the virus up to a month. Let's say a person fell ill and they did not recover, they have high fevers, they're getting worse. What to do next? The next thing is to go to the ER. You can go to the ER 2 ways. Call 911, the ambulance will come, take them. That is the safest mode of getting them over to the ER. But if a person is in New York City these days, and the ambulance services are so inundated with calls that it may take a while before they can respond to you. They'll ask you if it's not a life or death situation and you're just beginning to really get sick, then they may recommend that you drive. So a person who's driving, again, you want to take a low-risk person who's driving. There should only be one person going with the person who's sick. Both of them should be wearing masks, and they should be as much of a distance as possible, so that the person who is sitting in the back seat looking towards the window, away from the driver. And then when you're in the ER, you've got to be careful. They are not allowing a lot of family members to be there or to be with the patients once they are admitted. Patients' families are being turned away so they can go home. So mentally, just start getting prepared in case a person were to fall in without panicking. And again, I'm available. You have my cell numbers, and other community members and family physicians are available to help you and guide you. In the hospital, what to expect? In the hospital, about 20% of patients will end up in a hospital, of those who fall in. 5% of those will get very sick, and they will end up in an intensive care unit, most likely on a ventilator. So they will, of course, not be accessible. The other 15% will be under close supervision and care, and the treatments that are being offered, hydroxychloroquine has been shown to be effective. It is not curative, but it has reduced the viral load. It has reduced the severity of illness, and they are standard protocol. People will get usually 400 BID of hydroxychloroquine day 1 and 4 more days of hydroxychloroquine. They will be, for the more severely ill people are also getting an antiviral drug, which is remdesivir. It's an IV infusion. Some people will get Rucephin and azithromycin. I don't want to bore you with all the medical details, but this is coming up. I mean, in the social media and WhatsApp groups is being circulated. There are some IL-6 interleukin inhibitors that are looking quite promising. And then there's also convalescent plasma from people who have recovered. And so that is being tested again. Again, the virus alone does not hurt the person or make them very, very sick. Many times it's the body's immune response, which is so severe in some patients that severe response sometimes get them on the ventilator or takes lives by inducing ARDS, a condition of severe lung disease and multiple organs failure. So 30% who get on a ventilator will survive. These are difficult numbers, and my job is not here to scare you, but just to give you realistic expectations, because there is no cure right now. There are some promising therapies, but those who are severely ill, of those in the ICU, on the ventilators, it's really a slippery slope. So what is the best thing we can do is that if we can be careful and not spread the disease the way it spread in New York by taking the precautions, then the healthcare system is designed to take care of people who are sick. That could be any one of us. And the physicians are dedicated, the nurses are dedicated, the staff are dedicated, and they're eager to help. They want to see people come in, have least amount of suffering, and go back to their loved ones in a safe manner. But if we are irresponsible, and this virus can shed 3 times more than influenza virus, and you've all heard about the 1918 influenza epidemic and how thousands and thousands and thousands of people just in the US died. If we take the precautions, we take heed, we can hopefully reduce the spread within Texas. Right now, Texas is doing well, unlike some other states. So now let's go on to the topic of what are the natural ways to boost your immune system. And this is based on scientific data. Number 1, sufficient sleep. You've got to have a good night rest at night. It has been shown that the immune system, the fighting capability of our body against infections, especially viral infections, are better if you are well rested as opposed to if you're exhausted. Eating fruits and vegetables, they have natural vitamins. They have natural immune boosting capabilities, fruits, vegetables, and nuts. Honey and haldi or turmeric has a lot of natural powers, and honey has been mentioned in the Quran how much shifa it has. And then sunlight, not having to go out, but sunlight is good for us. It helps boost our immune response. One of the more potent ones is exercise. So even though we are confined or locked down at home, there's so many, exercises we can do just in confined spaces. If you have stairs in the house, if you have light weights, if you do stretching exercises, you need to do about 25 minutes, 30 minutes of exercise a couple of times a day. You should be huffing and puffing if you can. Otherwise, whatever best you can do, you've got to stay active. The more sedentary we get, the more our immune system starts getting less robust. And one of the most important things, I saved it for the last, is reducing stress levels. That is easier said than done. In families who are suffering, or those who have loved ones who are sick, the stress level, I can't even imagine. But our imams say that we have to keep the fear and hope, which is khawf and raja, at balance, 50% at each. If you have too much khawf, it won't work. If you are overly optimistic, then you will become cavil, and you will become too casual, and you will not take the precautions that are necessary. So a balance between the two will help, and I don't have to, preach to the choir. Allah bi zikrillahi tatma'innul qulub, and mashallah, Moment Center, CFK, wherever you see their There are programs going on in the month of Shaban, of Dua, and that has such a profound reduction of our stress levels and help boost our immune system, um, which is, again, very scientifically based, um, help. How to reduce your risk of complications. So in addition to the nutrition, the exercise, and the stress, the second component is if you have pre-existing diseases, you've got to get those managed really nicely. So we cannot change our age. I mean, the younger ones here are blessed, alhamdulillah, and their immune system will be good. The younger ones, I'm talking about less than 18. Anybody over 18, be careful, be mindful. Above 55, you start getting even more cautious. Above 65, even more so. If a person amongst you have heart disease, those who have high blood pressure, make sure that you have your medications, your blood pressure is well controlled. Monitor it a couple of times a day. Call your physician. We are doing video online conferences and chats and clinics. I do it every day, video clinic with my patients. So make sure you are taking your medications on time. Your blood pressure is well controlled. If you've had a heart attack before, make sure you have all the right medicine that you're taking at proper doses. Also, eat well. Reduce salt in your diet if you have high blood pressure. Do some exercise. Those who have lung disease, those who have asthma, take anti-allergy medicines. If you have to take inhalers, make sure you take inhalers on time, that your lungs are in perfect shape as they can be. So in case you get the virus, you will not end up being severely ill. They found out vast majority of people who were severely ill had uncontrolled pre-existing conditions that they were not taking good care of themselves, such as diabetes. That's a big one. So these are the days that if your sugar levels are high, just make sure that you eat well and then keep your hemoglobin A1C as low as possible. As the hemoglobin A1C levels rise, the immune system starts getting numb. So it cannot fight as efficiently, because ultimately you're counting on God and you're counting on your body's immune system to fight off the virus, because the therapies are not curative and they're not available in many situations. So again, take care of your medical conditions. This is how one way you can reduce the complications if you were to acquire this infection. Why is this pandemic so difficult to control? Why? So let's look at some of the facts. Number one, about 17 to 25% of patients will start shedding the virus, transmitting it to others while they have no symptoms. So they're completely asymptomatic. So they're these innocent people who are spreading the virus. Now, they may not even go on to develop bad illness. After 3-4 days, some of them will get symptoms, but they will recover quickly. But in the meantime, they may have exposed a whole bunch of people inadvertently who may get very sick. So that's one. The second component is the airborne feature, that other than the droplet, the airborne feature is what we need to be mindful of. So when you're going in public places, please wear a mask. The masks are not perfect, because many of the masks will not have perfect seals. If you have glasses, that is good. If you wear goggles, those are good, because again, eyes are exposed, and the nostrils, of course, are not exposed as long as you fill the back, and you maintain good distance. If everybody were to wear a mask, the single most important thing that will do is that the person who is shedding the virus without knowing it, when they breathe, it will stay within their closed space and will not go out aerosolized in the vicinity. So that is more important than the person who's trying to prevent catching the infection, the person who's shedding inadvertently. And if everybody were to wear the mask, the infection spread will go way down. The other thing is surface. When this virus comes in contact with a surface, such as a Amazon delivery box, it can stay on the surface usually for a day or two, but they have done studies and found that the virus can survive up to 8 days, not 9, less than 9 days. So we'll talk about how to decontaminate. So that's another problem, that these surfaces are acquiring these viruses from, and people are then touching the surfaces. And we touch our face about 24 times an hour. And that was maybe more, maybe less. I realized that while just giving this presentation, I touched my face a few times. And so that's a potential source of how the infection can spread. 15% of healthcare workers who are conscious and careful get infected. 15%, that's a high number. And then the vast majority of people who will get infected will be the family members, because we will come in close contact with them. So good hygiene practices are very important. And then there are these super spreaders. These super spreaders were in places where there was a lot of public gatherings, or travel was by buses or by trains, and then the one person kept infecting a whole bunch of people, up to a couple of hundred from one super spreader. So now let's move on to what is the right way to disinfect household surfaces. I said the virus can last up to 8 days on surfaces. So just wherever you will come in more contact with your hands and your arms, think about those surfaces where you're more often: tables, chairs, doorknobs, light switches, the handles, faucets, toilets, sinks, electronics. Phones are a big a risk. Keyboards, touchscreens, and if you drive a car, then door handles against steering wheels. Just common sense. The surfaces that a person is coming in contact with, on at least once a day, or more often or less often, depending on what your exposure is. Use either isopropyl alcohol, that is hard to find, should be more than 62% in concentration, of bleach. Just 1/3 of a cup of bleach in a gallon of water will do the job. And bleach is available a lot more. I checked the other day in Costco, they still have bleach available, household bleach. And now, if a person is infected and they are at home in isolation, then you have to become really vigorous how frequently you do all of this cleaning. Similarly, if the packages are coming from outside, that you leave them, don't touch them unless they're urgent. Again, wipe them, clean them with simple solutions. The virus is very easy to kill. Within a minute of being exposed to these chemicals, the virus is dead. Less than a minute. Good hand washing and hygiene, can't say enough about that. Steps to take when you're returning home from outside. Those who are healthcare professionals are doing it as it is, but let's say you go to workplace, and it is, despite social distancing, there could be a person who's exposed and he's shedding virus, or she is shedding virus, you don't know. One good rule of thumb is when you come, wear a mask. When you come home, take the mask off from the side. Don't touch the front part. Take it off and I put it on the dashboard of my car unless I'm driving. I'll put it in a brown paper bag, and not to use it for 3 to 5 days ideally. And you should take a fresh mask the next day if you're going out. The mask can be homemade, or if they're commercially made and available to you. If you're coming from public places, what I do is I keep my undergarments on, but I take my clothes off, put them in a bag, go straight to the washer dryer. The bag will go. I will go straight to the shower, take a shower, and then I will come out and start interacting with my family. If I've touched a doorknob, I will take again the cleaning solution, and I'll wipe every doorknob that I checked along the way to the shower. And if you buy non-perishable stuff, leave it out, leave it in a place that you don't touch for a while. Clean the surfaces. If they're perishable goods, such as vegetables and fruits, then you, again, take them out of the container, leave the plastic bag outside, plastic container outside, take the fruits and vegetables, wash them with soap and water, and then wash your hands well. Next, the topic I wanted to cover: if you fall ill, who to call. Let's say you just have, fever and cough. You think you may have coronavirus. If you can get tested, that is ideal, but we don't have rapid testing available in Texas yet, in DFW. Call your PCP, make them aware that you are sick, and they will just guide you in the way I'm telling you how to isolate yourself. But at least you maintain a contact with them. They know you may have an infection, that you may need help, and they'll guide you about their policies and when you can reach them. When you go to the ER, one thing to remember: high fevers that are not going away. More importantly, shortness of breath. If a person is short of breath, go to the ER or call 911. People at risk, uh, you should be more vigilant about them, because they may rapidly progress from being just mildly sick to being severely sick. So just keep that at the back of your mind. Lastly, the how does this pandemic end? I've talked to a lot of experts. I'm a cardiologist by training, but I knew that I've been invited to give this presentation. So I spoke to the director of infectious disease control at Baylor Hospital. I spoke to Dr. Hassan. He's also an infectious disease specialist. And I spoke to lung specialist, both at Baylor as well as another one. So I've spoken to a lot of people about this, and gotten a good sense of what to expect. So inshallah, the way this pandemic potentially can end is an antiviral drug that comes about, and there's robust research going on, and hopefully we can get hold of a drug that any person who starts developing illness can have it, especially those who start progressing from mild to severe, take the drug, and then the viral activity and the disease process may subside. But that's something we can do dua for, and there's a lot of scientific work going on. We should support that scientific work. The other thing is herd immunity, in which enough people will get infected over time. If you do the math, let's say right as of today, maybe close to 300,000 citizens in the US have confirmed coronavirus. There may be, this is just an estimate, there may be 10 to 20 times more people who are out there who had the illness. Okay? And they recovered, so they have the immunity. The chance of reinfection in US studies was 0.45%. And in one Chinese study, it was less than 5%. So the reinfection chance is very, very low. So if enough people develop immunity from this disease, then the virus cannot then jump from one to another, because it will not find friendly hosts, or the hosts that are vulnerable hosts. But that's a big number. That 40 to 50% is almost 150 million US citizens have to get the infection in order to gain the immunity. So our job is to reduce the spread, that we have to blunt the curve, so that the healthcare hospitals and workers can take care of those who fall ill over the next weeks to months. So antiviral drug is number one. That's our, that's a great hope. The other one is kind of inevitable. Herd immunity, meaning enough people getting sick. And then there is a decline of the virus. Look at China, look at Italy, look at Spain. They may be reaching a peak and dipping now, and New York's the same way, that it may be reaching a peak and dipping down, inshallah. The wide spread availability of viral testing. We can test the person who's infected and then immediately isolate them, then that would be perfect. That's how South Korea is doing it, and they've been able to get a real good handle on it. We haven't reached that stage yet. That will be able to limit the spread of infection. And then another exciting thing that I think is most realistic, if you were to ask me as a physician, most realistic is the antibody test. The antibody test is coming out. There are two of them that are approved. There are two types of antibodies that are generated when a person gets an infection, an IgM antibody, which is generated very quickly, and then there's an IgG antibody. The IgM antibody will tell us that who has the immunity, and then these people can be safe and they can come out of the lockdown, and that's how the community will start, again, going back to normalcy, as close to normalcy as possible. And then these people can also be at the front line in healthcare, treating patients who are sick. And even at home, the person that we know has the immunity can take care of the person who is ill. And that way they can protect spread of the disease. The vaccine is there's a lot of hope for vaccine, but vaccine is a difficult thing. You have to vaccinate a group of people, and then hope that that vaccine will generate enough immune response that will be protective. Those are two ifs. Then you take this population and send them into the community, and then evaluate them over months and months and months to see, are they getting less infection? Number one. Number two, when they get infected, is it a less severe infection? And if that is proven, then the vaccine will get approved for mass use, and it has to be produced on high scale to be supplied to the world. So realistically, that's going to take 12 to 18 months. By the way, there's also a caveat. Sometime the vaccine will produce an immunity, and then this immunity will be dangerous. And when they're exposed to the virus, a live virus, it can make the person sicker. So vaccine is not just as straightforward that, hey, the vaccine will come, like some movies will, like Contagion, the vaccine came and started, taking care of the problem. What are things that we can do ourselves now at the end to again, I touched my face, sorry about that. What can we do to help this whole situation? People who are at risk, they need to start taking care of their health. They should eat better if they're diabetic. Everybody should eat better. Exercise more. People who smoke, this is the best time. If you have the courage to quit, this is the best time to quit. Within weeks, the lungs start showing signs of recovery. There are cilia in our lung lining. There are millions of cilia. They are the brushes, they clean the lungs. And that's what causes the smoker's cough, because at nighttime when they sleep, they don't expose, the cilia are not exposed to the smoke. So they wake up and they start brushing the lungs, cleaning it out. They're the sweepers. This is the best time to quit smoking. I plead to my fellow community members who smoke. If you cannot quit, cut it in half. Cut it even more if you can. Ideally, if you can quit, that is best. Within weeks, your chances of survival will improve. Within weeks, your chances of getting severely ill will improve. And it would be such a good thing, such a good example to set for all others. It's not an easy thing to do. I know it's very hard. It's one of the hardest habits. All of us, whatever negative habits we have, all of us have our own vices. I have my own vices. This is the time. This is the time to reflect, change, improve ourselves. So at the end, I would say that there are three approaches that I'm doing for my own self, and I'm sharing with you. Number one is, of course, dua and tawassul. Dua with tawassul. I mean, what is more powerful than that? Secondly, improve ourselves, our iman, our akhlaq, our actions. Take care of our weaknesses and turn them into strengths. And then help each other. I mean, what better way to uplift ourselves in the eyes of Allah and Ahlul Bayt is by helping each other in these difficult times. So with that, I will end. أَمَّنْ يُجِيبُ الْمُضْطَرَّ إِذَا دَعَاهُ وَيَكْشِفُ السُّوءَ. If you have any questions, I'll be happy to entertain them.
Thank you, Kizilbash, for such an informative session. We have a few questions. I posted the question in the chat, and I'll just repeat it for you.
Sure.
First question is, if a member of household tests positive after exhibiting symptoms, should everyone get tested? And I think the second part you have addressed already is like, what measures should be taken if the person has to stay in the same house?
Yes, if the person has to stay in the same household, they should be in a separate room. If you have a bathroom that you can dedicate to the person, that's where the sick person should be. They should um, use, the food that is delivered to them through the door. The food is left outside in a tray. They open the door, they pick the food, they bring it inside. If they're, they should be well enough to do it, because if they're that sick, they have to go to the ER and be admitted to the hospital. They should have cleaning, they should wear a mask whenever they open the door to receive the tray. If there is a person who actually comes inside, let's say there's an older person who cannot do all of this, that person should be healthy. They should be a low risk person, ideally a young person should come and serve them. They should both wear masks. They should maintain good distance. Most importantly, the person who is sick should be wearing a mask when there's another person coming in. Use disposable items so you don't take these things back to the dishwasher. Their clothes and their linen should not be changed every day unless it's soiled. Their clothes should be washed again separately, and all you have to do is high temperature, hot water wash, and use some bleach, and that should be that is enough. Bleach is very effective, but you have to take extreme precautions. And if somebody is ill like this, we'll be happy to. I'm available. Just call us. We can guide you if you have questions. But those are the basic things. And use good hand washing, and make a solution that would be the disinfecting solution, and use it multiple times a day on the common surfaces that multiple people are going to be using, doorknobs and tables. And then you have to wait for the person to completely heal, ideally about 14 days from the onset of symptoms, could be as short as 7 days from complete recovery before they can come out. And then everything in that room, I would say leave the room alone for some time so the virus can die, and then go in with, again, mask and gloves and gowns, and clean the area up before the room is used by others. I hope I've answered the question.
The first part of the question, Ali, was that if a member of a household tests positive after exhibiting symptoms, should everyone get tested in the household?
Oh, ideally, yes, but practically it's not happening. Even the person who is ill at home most likely will not get tested, because right now we don't have enough tests. My son got fever. He had a high fever of 104, 103.7. I called the ER doctor just to kind of touch base with him to see whether, should he be tested. And he said, Ali, we don't have tests. We don't have tests for people even people who come to the hospital, they start getting tested. But those who are at home, we right now do not have rapidly available tests as yet. So most practical thing is, if you're sick, go in isolation. By the way, my son had been in touch with somebody with influenza B, and he's recovered completely, alhamdulillah. But the testing is not widely available. Call your PCP. If they have the test available, then yes, not only that person should be tested, but the others, family members, ideally can be. But realistically, practically, it's not there yet. Hopefully, down the road, we will be there. Right now, we don't.
Thank you. The other question we have is there is a lot of information out there that there are two types of strain, like an S and an L type. Is that true?
Yeah. In China, the strain that initially came about was an L strain. I want to make sure I don't misrepresent. And then the second strain was present in 30% of patients. The strain that is outside China is actually the second strain. These RNA viruses are very unstable. They're not genetically very stable, so they do mutate. And that is why getting a drug, an antiviral drug that will just kill them off, it's not easy. It's not easy. So your best defense is your own immune system. So take care of your health. That is the best. But inshallah, there are a couple of promising drugs that are coming out. And if they come out, they can at least reduce the symptom severity and hopefully reduce the period while we shed the virus.
Anyway, the next question is you mentioned about the symptom, like shortness of breath, right, as an early symptom.
Yes.
The other symptom that have been talked about is the loss of taste or smell. Is that a common symptom for anybody who is actually infected?
reading the literature is present in about 30 to 40% of people. So that is, it's usually, it's not the earliest symptom. The most common and the earliest symptom that a person would have is fever. Those who are going to have mild to moderate disease. Along with that, some people would have cough and myalgias. Those are the more common ones. Myalgia is just feeling sick and tired and having body aches and pains like when you develop flu. Those are the more common ones. But yes, it can cause loss of smell. That was present in about 40% of people. Although in social media, it seems to be the most common one. You lose smell, you know you have coronavirus, but that's not true. You can lose smell from other viruses as well, like influenza viruses and other rhinoviruses. It can also occur in more likely in people with allergies. If you have a flare of allergies, you lose sense of smell. So fever, cough, myalgias, those are the more common ones. Shortness of breath is not usual because shortness of breath usually means a lung infection. Not always. If somebody has asthma, well, any kind of viral infection can exacerbate asthma. But again, they're at a high risk of developing complications. So dyspnea, shortness of breath, should be a red flag. If somebody starts getting short of breath, they can go downhill fast, and that's when you seek ER evaluation quickly.
Thank you, Ali. One other question we have is, like if a person unfortunately passes away, because of COVID-19 infection, does the body stay, is the body still contagious, and for how long?
Yes. In people with severe illness, they have found viral load in the nasopharynx, in blood, in feces, up to a month from the onset of symptoms, can go up to 37 days. That's in the literature. So a person who dies from this illness, the body most likely can have and should be treated as if they are contagious. There is a phase of viral infection in which when the person gets very, very sick, the viral load really goes away and they die from a cytokine storm, which is a storm from our immune system that starts to fight. Our own immune system generates such a robust response that it starts causing more damage. And in some patients, the viral load is very, very low. You can't detect it. But a person who dies from this infection, the body should be considered infectious and contagious.
The next question we have is, can certain prescriptions like, don't know how to pronounce, Montelukast, help with reducing inflammation and improve breathing if you're having shortness of breath due to COVID-19?
If I remember correctly, this is the medicine given for people with asthma. And it used to be called Singulair, and I think that's the generic name, Montelukast. And so if you have asthma, then you should treat your asthma before you even get infected in the best possible manner so that you are healthy. But during the infection, there are a whole set of protocols, and statins are being used. Some people are using, ACE inhibitors, although that is not proven, but statin is, these are cholesterol drugs. Why would you think cholesterol drug would be used for somebody with a viral infection? But there's some data to support that it reduces the effect on the heart and overall, the improvement of patients. Similarly, there are, plasma from patients are being used. So there are a lot of investigational drugs that are being used. There are multiple clinical trials that are going on in centers, so they may enroll a person in that trial. But Singulair is not a proven therapy. In any of those, I looked at protocols from 6 different hospitals, from Penn, Mass General, Brigham and Women's, talked to UT Southwestern physicians and their protocols. I don't know any place that uses Singulair or Montelukast as a good therapy. But if somebody has asthma, you got to treat asthma.
And the last question we maybe have is, in your professional opinion, what would be the increased risk level of an otherwise healthy individual that has atelectasis?
Atelectasis?
Atelectasis.
Okay, so atelectasis is essentially when lungs don't expand fully. These are usually people who have either they are bedbound or they're not very active, and or they have lung disease. So when the lungs don't expand fully, the area that are not ventilated, they don't get enough air. They are called lung. Those parts of the lungs are called, that they are atelectatic. So if a person has lung disease, things you can do, this is the best time. If you smoke, quit smoking completely. That would be 100%. Number two, if you are on inhalers, such as these are, inhalers that are to reduce the inflammation in the lungs. So use them on a regular basis. Take anti-allergy. Make sure your lungs are in the best possible shape that you can get them in, and that will help improve atelectasis as well. And also breathing exercises. So there's an incentive spirometer you can use. Those who have it, those with atelectasis, many times their physicians will give them incentive spirometer. But if you don't have it, just do some deep breathing exercise like people do in yoga, or just take a paper towel and blow as hard as you can, or keep a candle at a distance and try to blow it out, and that will make you take deep breaths and blow a few times, every few hours. That will expand the lungs and it will decrease atelectasis.
I think those are all the questions we had for tonight's session. Thank you, Ali Kizilbash.
Most welcome. Stay safe.
For this informative session. And on behalf of the Islamic Center Movement and the Program Committee, I would like to thank you for taking time out of your busy schedule.
It was my pleasure. Thank you. Khuda Hafiz.
And before we wrap up, just a reminder for tomorrow's program. Tomorrow, inshallah, all those who are tuned in, we will have a program tomorrow at 8:30 with Maulana Sayyid Ali Murtazedi. It will be live from Karachi. The program will start at 8:30 and with the recitation of Quran and then manqabat and then speech by Agha Ali Murtazedi in Urdu. And after the program, we will have a short Q&A session. With that, before I wrap up, we ask Allah to heal those who are infected with this virus and bless them with good health. And may His mercy be bestowed upon the deceased and patients, reward bestowed on the families and loved ones. And besides all the precautions and the social distancing guidelines that are out there, do not forget this is the blessed month of Shaban. So do not forget supplication to Allah. Inshallah, we will get out of this situation.
Inshallah.
Thank you for tuning in. Khuda Hafiz.
Khuda Hafiz.